this is Dr. Joseph Aiello from San Diego Center for Integrative Medicine, and today I want to talk to you about your thyroid numbers. A lot of people have questions about what are the meaning of the different thyroid numbers and what are you looking at. So today I want to tell you that we look at a couple of the numbers. We look at the free T3, the free T4, the TSH, and the reverse T3. And these are all important. The most important of those numbers, however, I feel is the free T3. And the reason why is because that is the active hormone that circulates in the body and actually performs the functions of the thyroid. The free T4 is important because that's sort of a storage form of the thyroid hormone, and we want to know where that's at. And also the TSH to some extent is important, but it's only important for me as far as diagnosing a low thyroid. The other thing that we like to look at is what's called a reverse T3. So basically what you have is TSH coming from the brain and telling the thyroid to produce thyroid hormone. Now if there's an excess of that going on, or if there's some stress or other metabolic or medical issues such as diabetes and hypertension, the body will convert some of the T3 into what's called reverse T3. This is important because reverse T3 is actually a mirror image of the real T3. So whereas the real T3 is biologically active, the reverse T3 will sit on the receptors and block the action of the real T3. So therefore, you may have normal T3 levels, but if you have a high reverse T3, you may feel a low thyroid sensation because your reverse T3 is actually blocking the effect of the real T3. So we like to look at the real T3 numbers, the actual free T3, not necessarily total T3. And then we like to compare that to what is going on with the reverse T3. Then for diagnosing a low thyroid, the TSH is helpful, but once you start someone on thyroid hormone, and also to diagnose whether someone has a low thyroid, the TSH is not necessarily helpful in the long run because the TSH can actually be low, and that is because the pituitary is very sensitive to the thyroid hormone. The pituitary may feel that the level of the thyroid hormone is normal and therefore not respond with an elevated TSH, indicating that the body needs more thyroid, but the rest of the body does not have enough thyroid hormone circulating around. So that's one of the fallacies of using a TSH as the only number to diagnose thyroid problems, because a TSH in the thyroid, the thyroid hormone may be normal to the pituitary, but the rest of the body is not getting enough thyroid because the pituitary is very sensitive to the level of thyroid in the body. This is a critical thing to understand because a lot of doctors will only follow TSH with the blood work when they're treating patients and the patients still feel badly. So what do we do now when we have a patient with low thyroid? I like to treat the patients with both the T3 and the T4 in a natural, what we call nature thyroid, compounded prescription. I find that this is very effective for helping the patients because a lot of times patients have a difficulty when they try to convert T4 into T3. So what does that mean? So basically, the body has a lot of T4 floating around, and that is the predominant hormone of the thyroid. That is what's called thyroxine, and it is T4 because it has 4 iodines in it. The liver and other parts of the body cleave off one of the iodines and make T3. The T3 is the active hormone. Some people have difficulty with converting that T4 into T3. And that's why when you get a prescription of levothyroxine or Synthroid, which is strictly T4, many patients do not feel well with it. So then when we use a nature thyroid that has a T3 and a T4 in it, they feel a lot different. What happens is the T3 acts over about 8 hours. They take it in the morning, about 8 hours later it starts to go away. But then the T4 kicks in later on, and it's a 24-hour hormone. So therefore they get a smooth thyroid boost throughout the whole day after taking that hormone in the morning. If you're only taking T4 and you're not converting it well, you're not going to feel so good. And that's where a lot of patients feel a lot better when we convert them over to the nature thyroid with the T3 and the T4. So I hope this helps you understand what your thyroid numbers mean and what we do with the thyroid when we treat it. Of course, we'd love to help you. If you have any questions, we're here for you. This is Dr. Joseph Aiello at San Diego Center for Integrative Medicine. Thank you.